Israel to ban foreigners from entering over COVID. The Israeli government is pushing for mandatory quarantine for all Israeli nationals returning from abroad. Israel is to ban foreigners from entering the country for 14 days and use surveillance to halt the spread of the new COVID strain, local media report. The ban is expected to come into effect at midnight on Sunday, following full cabinet approval. Israel has so far confirmed one case of the potentially more infectious Omicron strain first detected in South Africa. Many countries have since banned travel to South Africa and its neighbors. South Africa has complained that it is being punished, instead of applauded, for discovering Omicron earlier this month. The World Health Organization, WHO, has warned the new variant is of concern, with early evidence suggesting a higher reinfection risk. However, the WHO has warned against countries hastily imposing travel restrictions, saying they should look to a risk-based and scientific approach. The Israeli coronavirus cabinet agreed a series of new restrictions at a crisis meeting late on Saturday and are subject to final approval by the larger cabinet. In addition to the entry ban for non-Israelis, a 3-day mandatory quarantine would be required for all vaccinated Israeli nationals and a 7-day quarantine for those who have not been vaccinated. The cabinet also authorized surveillance of confirmed coronavirus patients by the Israel's Shin Bet security agency. In a statement, Prime Minister Naftali Bennett said phone tracking technology would be used. Earlier on Saturday, the Israeli authorities had put 50 African nations on the so-called red list. All Israeli nationals returning from those countries must quarantine in the government-approved hotels and undergo COVID tests. A ban on foreigners entering Israel from most African countries was imposed on Friday. Israel has confirmed more than 1.3 million COVID infections since the start of the pandemic, with over 8,100 deaths, according to America's Johns Hopkins University. It is a rapidly evolving situation. Omicron's genetic profile has raised concerns, but there's a shortage of real-world data. That means nobody has the complete picture of what it can do. It is unclear how big a threat it poses. Yet, it is at this early stage, in an absence of definitive facts, and when there is a danger of both underreacting and overreacting, that governments have to act. It's like you or me deciding whether to marry someone after the first date. Only the stakes are much higher. What we know is Omicron has mutations that theoretically help it to spread more quickly, and there is mounting evidence of that happening in South Africa. It also has mutations that theoretically make vaccines less effective. But we don't. Israel to ban foreigners from entering over COVID. The Israeli government is pushing for mandatory quarantine for